Whenever I have a client that comes in with lower back pain, I teach them how to hip hinge to save their lower back. Everyone, my name is Ed Dubu, physical therapist out of Bellingham, Washington, Integrative Physical Therapy. We only have a certain number of bends in our low back, and if you've ever had an MRI or an X-ray, you'll hear fun-sounding things like degenerative joint disease or advanced arthritic changes. Some of that stuff is just normal as we get older. But we want to try to save the discs and our lumbar spine as much as we can. How do we do that? This example, I'm just going to bend forward like I'm picking something up. And I want you to see how rounded my spine is right here. Now, once or twice, that movement is no big deal. But as I continue to do it decade after decade for thousands of times, that's going to eventually take its toll on my low back. So a better way to do it is to drive the hips back and to hinge at the hips. So in this situation, my hips don't translate back at all, and it's all lumbar spine. But if I can hinge at the hips, drive my hips back, now what I feel is a hamstring stretch, but my back is fairly flat, and that's going to save my spine. How do we train that? Your PVC pipe, we have 2 contact points. Your sacrum and the back of the head. Soft knees, engage the core, and drive your hips back. If you do the hip hinge correctly, when you get to the bottom, all you should feel is hamstring stretch. And then you know you're doing it correctly. If I do it incorrectly and get it from my low back, I lose that sacral contact point almost right away. Keep practicing the hip hinge until it becomes second nature, and then use it all the time. Brushing your teeth, unloading the dishwasher, whatever you need to do. I'd rather have your legs and your hips working than the lumbar spine.
If you found the video helpful, please consider subscribing and giving a thumbs up. If you have any questions on the hip hinge, please let me know down below. All right, thank you.